Can I just pick up the wider comms question that Trevor raised? The Department of Health has just in the last couple of days put out what's called the comms link, which is the messages, the important messages the department wants to give out to the communication staff throughout the NHS, so PCTs, SHAs and trusts. And they've just put in a piece there to clarify the situation in the way that we've described, that we're not being closed down and 111, etc., the plans for 111. So I think there is a commitment to get that message out. I think we will continue with the East of England support to make sure that our availability, particularly this upcoming winter, is known and is part of people's winter pressures plans, because what we do know is that 0845 provides a very positive contribution to handling winter pressures, because otherwise patients, in not knowing what else to do, will pitch up to their local GP surgery or hospital, and if that's not necessary, then that simply adds to the pressures. So we will continue to push that as not specifically to say we're not being closed down, but to extend to describe the positive. So.
Okay, do you want to carry on then?
Very quickly, an update on practical update on 111 in terms of the 3 Pathfinder sites. We've been handling a small number of calls from the northeast pilot on the basis of us handling health information, and we're keeping a close track on those. Secondly, we're working in the East Midlands, and I believe that the service is due for what's called a soft launch. In other words, we put in place the operational handling of calls, but without the publication of the 111 number in front of it, and that's due to go live tomorrow. And finally, in Luton, I suppose I'm thinking geographically, that's why I say finally, going from north to south. In Luton, the service actually went live in an operational sense, handling the GP out of hours calls on the 9th of September. So we're working with the department and those local health communities in those ways, and we will look at what the learning is from each of those 111 pilots to see, for example, what is the effect on referrals into A&E and GP services, and all those important parameters.
Okay, we'll take a question from Trevor, and then we must decide, Nick, whether there's anything else you particularly want to highlight, or whether to take questions generally. Yeah. Trevor.
Yeah, I think the North Eastern Service was the first 111 pilot to get underway, and that's some months ago now. I wonder do we have any referral data from the North Eastern pilot yet, as far as hospital referrals are concerned? Is it rising? Is it falling as a consequence of the change?
We don't. I mean, the North East went live as a 111 site, with the public knowing about the 111 number on the 23rd of August. It's been operating, as it were, in a soft launch capacity for much longer than that. I know that the department is drawing up comparisons between the North East Ambulance Service and other examples, including West Yorkshire, and that's going to form part of their thinking and advice to the Secretary of State about how 111 should be taken forward.
But do we have any data on referral rates yet?
I've seen data, but it's not data that has yet been published. So I'm being slightly careful. Yes. It's not my data to publish, so I can't publish it.
How would you use if we could have any data as soon as it is published? It's quite
Absolutely.
important to
Yes.
look at the implications.
Yes.
Tim?
Do we know the success criteria for each pilot?
What we've got is a broad set of objectives and a specification of the 111 service. I don't think that's been calibrated into specific numbers. For example, taking Trevor's point about demand into face-to-face services, there isn't a a specific level that's been set at to say this is what we expect 111 to achieve.
Nick, would it be fair to say, I mean, these are not pilots, they're pathfinders.
Sorry.
So it's not a do they meet the criteria kind of test, it's how do they work and how could they be improved.
Yes.
The rollout.
That's a good point, actually.
Yeah.
I was still calibrated by the word pilot, I guess.
Okay. Nick, is there anything else you particularly want to draw our attention to, given that we've had
In
an
the
opportunity
report?
to look at the
No,
report?
I'm very happy to take any questions.
Oh, Roger, I'm sorry. Yes.
So just a small point. I think the anxiety of staff has shifted from NHS Direct's immediate future to the need to try to understand 111, and just to let the board know that we've got a frequently asked questions site up on the intranet that we are updating almost on a daily basis as information about 111 emerges.
Okay, thank you.
Because it is quite difficult to understand if you're just coming at this stuff cold, which a lot of people have. Sure.
Okay, very good. Yes. So Helen is going to present to us the service review programme as a slide. Before we get to that, are there any questions about anything else in Nick's report? No? Okay.
I just had one small thing.
Peter, yes,
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 all
please.
right. Just on the headquarters, and obviously the value for money item is very clearly there.
Yep.
I was just, given that we've got other things going on in December and later in the agenda, I just want to make sure that making such a move for the headquarters is not counterproductive in any way around focus and capacity of management to deal with more, which rather than many more important things might be the restructuring of services.
I can give you a complete assurance that the physical disruption of moving the headquarters, as you say quite rightly, for value for money reasons, that will be minimal. I have taken the step of engaging a full-time project manager who's around headquarters today if you want to meet her, and her job is to make sure that effectively we can close down for business on a Friday afternoon and move to the new location over the weekend.
Thank you.
And that life will carry on as normal.
Thank you very much.
That's the objective.
Thank you very much.
Okay. Are we going to get a slide up on the screen for the service quality review programme? I think board members will remember that we have looked at the idea of service quality reviews on at least one occasion, possibly more. We haven't, up till now, had an opportunity to see what the plans are for delivering the reviews. And Helen, would you like to just talk us through your timetable? I think what we're really keen to understand is how this is going to play out, particularly for the first few, and when the board can expect to see those reviews brought to it, because we see this as such a fundamental part of our ongoing continuous improvement programme to make sure that all of our services continue to get better and move forward as we accumulate experience of delivering them.
Yes, thank you, Chair. The slide in front of you, and indeed on the screen for those not present in the room, shows you on the left-hand column the title of the reviews planned. And then as you work through the slide, you will not only see the project lead from the clinical directorate, who's not the sole lead of that piece of work, but at least is the owner from the clinical perspective of each service review planned. Alongside those names, we have business development colleagues and we have operational colleagues, and where appropriate we have support from the other directorates, but at least there is a project lead and an owner of each project listed in that second column. And then the slide describes the trajectory, planned trajectory for each one of the service reviews in terms of when it will be, when the group that will be leading that review will be formed, and when the scoping activity in terms of reference for that review will take place, which are the pink boxes, which precede the green, which is when the activity of the service review itself will take place. So we have today received the Own Health Service Review at Clinical Governance Committee and some of its findings, and the next on the agenda is the Out of Hours review and the West Yorkshire Urgent Care review. There will be two separate reviews. Out of Hours and West Yorkshire Urgent Care will be done as separate reviews, albeit that the Chief Exec will confirm timings as soon as the lead for that piece of work has agreed to them. So what we've tried to do is to demonstrate to you on the slide that the Clinical Governance Committee has seen Birmingham Own Health and will see West Yorkshire Urgent Care and the Out of Hours review. But from that point forward, the board will receive the service review reports in full, because this is a report about the quality of the service, not just about the clinical safety, effectiveness and user experience of that service. So whilst there are teams assembled for Out of Hours and indeed West Yorkshire Urgent Care, it's fair to say to the board that as we move through the list, from TAL, dental, palliative care, health information, etc., we will amass the teams according to their expertise and in terms of what the review seeks to do at a later date. So I don't yet have teams identified for all of those, although I clearly know which directorates are going to be involved, and I have likely involvement and names from the directorates, but not yet confirmed. And it's important that I make that transparent to you today. And you will see the correlation between the clinical governance date and the board date when we're due to receive the reports from the service reviews.
Okay. So, and Sue, you're going to be reporting orally from the Clinical Governance Commission meeting that happened earlier today, and
Yes.
that received the first of the service reviews.
It did.
Good. Okay. Thank you very much. Are there any questions for? Thank you, Helen. Renee.
Hi, there's a question. In light of the conversation that we've just had, I wonder whether we might want to put in a review of our own for the 111 service towards the first quarter of next year. It's quite separate from Out of Hours, and probably before TAL in terms of timing, just so that we can satisfy ourselves that the safety and integrity of the service generally.
Helen, how far has the Out of Hours review got?
It's literally got to the point where the group that will be doing it are having their first meeting on Monday, and Ruth and I are chairing that. So in terms of setting up that.
I mean, is there a question about whether reviewing Out of Hours as we do it now is, how important that is in the light of the fact that it's very.
I think it's very important because I wouldn't like to assume that 111 will take over from GP Out of Hours straight away. Otherwise, we'll have a rerun of the 1110845 conversation. So we've got at least 2 years where those services will be going forward.
I think that suggestion of 111 reviews
That's a good one.
is a good one.
Yeah.
So can we take that as an action?
Yeah.
Good. Thank you very much, Helen. That's great. Okay.
We'll work on the substitution principle rather than the addition principle. So we'll go through and work out which one of the ones on this list will slip.
Yeah. Okay. All right. So we're still in the performance section of our agenda.